Sterilization takes place by way of ligation of the fallopian tubes. We also call them as salpings. So here we also say as a tubectomy procedure. So there are certain things that need to be considered when they can do a family planning operation. So normally they can do it at the time of delivery. So where the patient will be hospitalized. So what they do, second or the third day, they might schedule this procedure. So you can report that code for ligation or transection of the tubes after delivery during the same hospitalization. Or this can also be done as a standalone technique where the patient might have undergone the delivery. They maybe after like few months or few years, they will be doing the family planning sterilization operation. In that case, we have a separate code for ligation. Next is, we have when the patient is undergoing a cesarean section, they would do a family planning operation. So you have a separate code for that as well. And lastly, there is a laparoscopic approach which you can code it accordingly. There are two types of ligation, whether you are going to ligate with a rubber band or any other device. Accordingly, we can, or Falope ring or any occlusive devices, we have separate code.